This is part 4 of the week 3 announcements. So this is part 4 and hopefully the last part. But I'm going to have to go kind of fast through these slideshows. There is part A, B, and C in chapter 19. So we are in chapter 19 now, and when we talk about blood vessels, there are 3 major types of blood vessels. Blood vessels called arteries carry blood away from the heart. So artery starts with A, away starts with A. Arteries carry blood away from the heart. Veins carry blood toward the heart. So for example, an artery is the aorta. The aorta carries blood away from the heart and supplies the rest of the body with blood. And then the major vein of the heart, or veins, are the vena cava. Veins carry blood back toward the heart, where the blood is either pumped to the lungs to pick up oxygen or pumped to the rest of the body to deliver oxygen. Capillaries are blood vessels that are so small they're microscopic. They only have a single layer of tissue called the endothelium, and they bring needed materials directly to the tissue cells. So capillaries are not always open. Different areas of our bodies have groups of capillaries called capillary beds, and those capillary beds can be open or closed depending on if the tissues in those areas need oxygen, if they're needing oxygen at that moment. The layers of the blood vessels, except the capillaries, because the capillaries only have a single layer of cells called the endothelium. The layers of the blood vessels are called the tunica intima, the tunica media, and the tunica externa. Let's look at the difference between an artery and a vein. Notice that in an artery, the lumen inside the artery is usually smaller. Lumen meaning the opening through the artery is usually smaller. The tunica media, which is the muscular layer, is thicker because the arteries have to withstand high pressure. The veins are going to have a larger lumen or a larger opening, and they're going to have a thinner, look how much thinner this tunica media is. So the tunica intima is like the endothelium, it's the inner layer, and then the tunica externa is the outer layer. But the tunica media is that muscular layer of smooth muscle that can either constrict or dilate for different reasons to help maintain homeostasis. Arteries branch into elastic, muscular, and arterioles. And elastic arteries are the very, very thick walled, and they're gonna have the highest pressure going through them. The muscular arteries are branches off of the elastic arteries. And then the arterioles are small branches of arteries that lead to the capillary beds. Capillaries function in the exchange of materials, of chemicals, substances like gases, oxygen, and carbon dioxide, nutrients such as glucose and amino acids, waste like urea that builds up in our blood. We want to get rid of that. And hormones, all of these flow through the blood and are exchanged between the blood and the interstitial fluid or tissue fluid. There are different types of capillaries, and you do have some questions about that, but I didn't notice that you guys were having a problem with those. The veins, okay. The blood pressure in veins is lower than in arteries. So if you think about it, blood from the bottom of your feet has to get up to your heart in order to be pumped to your lungs to receive oxygen. So how can we do that? Well, there's some adaptations that we have that help our veins circulate better. And one of those is exercise. The more exercise you get, the more muscle contractions, skeletal muscle contractions, are pushing against those veins and causing blood to flow back to the heart. There are valves in veins, which arteries don't have. Once blood passes a valve, the valve won't let it go backwards. And so they're most abundant in the veins of the limbs, particularly the legs. And then there are venous sinuses, like the coronary sinus is the area in the heart where all of the blood from the heart muscle itself, all of the blood vessels that supply the heart itself, what we call the coronary arteries and the cardiac veins. The veins are going to drain into the coronary sinus, and that coronary sinus is going to join with the vena cava and enter the right atrium of the heart. Okay, varicose veins are dilated and painful veins due to leaky valves. And sometimes this is genetic, and sometimes it's due to conditions like obesity or pregnancy, prolonged standing in one position, crossing your legs. There's different things. Hemorrhoids are varicose veins in the anus, in the anal veins. That's actually what a hemorrhoid is. Anastomoses are like branches. They're like alternative pathways. Whenever a when a surgeon is doing a cardiac bypass, what they're actually doing is they are taking a piece of a vein, and they are bypassing the blockage and allowing the flow of the blood to go past the blockage so that the blood can continue to flow through your heart. But there are various types of anastomoses. Let's move on then to Section 9B. I did not mean to say Chapter 9B. I meant 19B. So we're going to move on through. We're going to talk about how our blood vessels carry blood, how blood flows through our blood vessels. Blood pressure is expressed in millimeters of mercury, and we're going to talk about blood pressure and what is a good blood pressure and what is not, but we haven't gotten to that yet, so let's go back to this. Okay, so blood pressure is the pressure on the walls of a blood vessel. Resistance to blood flow is going to affect blood pressure. So blood viscosity is a factor that increases resistance. Blood viscosity is like how thick the blood is. When you're dehydrated, your blood is thicker because you have less fluid in your blood than you do blood cells. But blood viscosity is the thickness of the blood, the density of the blood, the total length of a blood vessel. And if you think about this, when a person gains weight and they get larger, their blood vessels that travel around their periphery of their body are going to get longer because they have a longer way to travel. So obesity is linked to resistance, because obesity would increase the resistance to blood flow because of it would increase the total blood vessel length. And the diameter of the blood vessel, the bigger the diameter is, the larger the diameter of a blood vessel, that would be the least resistant. When the diameter is smaller, when the blood vessels constrict, for example, that they're going to have more resistance. And this explains it a little bit more, those conditions. And they give you an example here where if you're trying to suck a milkshake, oh gosh, you know what I'm thinking about if you've ever had a Frosty at Wendy's. I am so grateful for these large straws at Wendy's and not these little small ones, because the Frosties are thick. So when blood viscosity is high, that's kind of like a Frosty in comparison to, something like a tea or a soda, which is easier to suck up through a skinny straw. So when the diameter is larger, there's less resistance. When the diameter is smaller, there's more resistance to blood flow. The longer that the blood vessel is, the blood vessel length, like this one here, would have less resistance to blood flow. Greater resistance to blood flow. And the blood viscosity is kind of like the thickness of the milkshake. The more thick that the blood is, the thicker that it is, the more resistance to flow. I'm going to skip this. This is a good chart showing you how the blood pressure goes from high to low. Blood pressure is highest in the aorta, in the major arteries, and then it starts to get lower in the arterioles. And so mostly what's pumping the blood in your arteries and arterioles is just the force of the blood pressure that comes from your heart pumping blood. Then the capillaries are going to be in the middle between the arteries and the veins, and the venules, then the veins, then the vena cava. The vena cava actually have the lowest blood pressure of any of your blood vessels. Now, systolic pressure is the pressure exerted during contraction. So it's a result of the contraction of the heart. It's going to be a higher blood pressure. Average systolic pressure in an adult is 120. Diastolic is the blood pressure that is lowest. That means that is the pressure when your heart has relaxed during diastole. So diastolic pressure tends to be average 80. So 120 over 80 is average blood pressure for an adult. Pulse pressure is the difference between the systolic and diastolic. So if you had average systolic and diastolic pressure, then you could say 120 subtract 80 is 40. The pulse pressure is 40. And then the pulse is just the throbbing of your arteries, which you can do at your wrist or you can do at your neck, your carotid artery. You're just measuring how many beats that you feel with your fingers. Mean arterial pressure, MAP, is the pressure that propels blood to tissues. This is the pressure that is needed to get the blood to your, from your capillaries to your tissues. Blood pressure average is 120 over 80. Pulse pressure average is 40. And then the mean arterial pressure, you can look at that on your own time. I didn't see a lot of questions about that. You can take a pulse at the radial pulse at the wrist, or there are other pressure points where you can take a pulse, like the carotid artery. You can easily palpate the pulse at the common carotid artery or the radial artery. Those are real easy. In little kids, you might use the posterior tibial artery or the dorsalis pedis artery down at the feet. The blood pressure cuff is called a sphygmomanometer. Sphygmomanometer. And the way the blood pressure cuff works is you cut off the blood pressure in your brachial artery, in your upper arm, and then you slowly release it. And as soon as you hear the systolic pressure, the first beat that you hear, wherever the needle is on the cuff, that'll be your systolic pressure. And then the last beat that you hear will be your diastolic pressure. And this explains that as well.